Meanwhile, we're getting some breaking news in regard to this cough syrup story, the deaths that have been caused. The World Health Organization has now responded to CNN News 18. The statement says that WHO is closely monitoring recent media reports from India regarding clusters of pediatric illnesses and deaths in the states of Madhya Pradesh and Rajasthan. The WHO has contacted the Central Drug Standard Control Organization, the CDSCO, for further information on these events, including clarification of whether there are potential links to contaminated medicines and whether these products were exported to other countries. I want to go across now to Himani, who's got this response from the WHO. Is there any role, what role, if any, does the WHO have in being able to monitor, who was responsible for this or recommending any kind of action against those individuals? What's the kind of level of cooperation that we see between the WHO and its the respective Indian agencies here, whether it's the CDSCO or the DCGI and so on?
Right, Zaka, WHO has contacted the country's apex drug regulatory agency, CDSCO, and has asked for more details on 2 points. One is they have sought clarification on the details of contamination. In the response, they say that so far there is no confirmation if the contamination is linked to diethylene glycol or if there is some other contamination. Second clarification they have sought is if these products are or were being exported, because WHO is a UN health agency, it's a global health regulator. It may not be able to intervene directly in the Indian authorities or with the Indian manufacturers, but depending on the response that Indian government will give to WHO will then assess the global medical product alert, which means that globally across countries, all health regulators will be put on alert for these particular products that are made in India syrup. We have seen this kind of alert was being issued in October 2022 when several children in Gambia lost their lives due to contaminated cough syrup. And in that case, we found DEG was the major culprit.
So, what is the difference between what happened in Gambia and what is happening now? Or is it the exact same thing, just the brands have changed and the companies have changed?
Right. You're right. This episode seems like a repeat of what happened in Gambia in 2022, followed by Uzbekistan as well. Because DEG1 is one of the cheapest possible solvent, and when we say that Sresen Pharma was manufacturing cough syrups laced with DEG, probably Sresen Pharma was not the one that was manufacturing the solvent, because generally pharma companies purchase these solvents from the third-party manufacturers. And these third-party manufacturers are not just selling to one pharma company. They might be selling to the entire ecosystem of pharma firms. And then it becomes a bigger tragedy. This seems to be much deeper issue than this is just a tip of an iceberg, it seems, because yesterday Gujarat FDA has also found contaminated cough syrups, and they have also issued alert against 2 companies. Okay,
so it's the solvent, and that may not necessarily have been manufactured by this particular company, but we'll see how it plays out. Thank you very much, Himani, for joining us and putting that into perspective. So the WHO now responding to CNN News 18's queries.